that they are going to close down the operation starting December because they don't have 5 million to buy drugs and do the operation. Your health system is failing the people of Papua New Guinea.
Saying that there's no money, no medicines, they are sending patients away.
Mr. Closing, that simply shows that the system has failed and he needs to overhaul the system. Thank you.
Facebook also, no got margin.
The honorable member for North Wagi.
Mr. Deputy Speaker, on behalf of the people of Jiwaka, to ask a question without notice to the Minister for Health.
Then continue. Ask your
Honorable Kapahore. So on behalf of the people of Jiwaka, we don't have any provincial health hospital. We only benefiting from the church-run hospital in Jiwaka. And I got a letter from the church management of the Nazarene Church that they are going to close down the operation starting December because they don't have 5 million to buy drugs and do the operation. And this hospital is not only saving the people of Jiwaka, but it's also saving the people who are living up in the islands too, including people from Ella, Southern Islands, Enga, and Western Islands, and Simbu too. So, Mr. Speaker, I want to ask a question without notice to my good minister that are you going to pay the request 5 million to the Kusuk Hospital right away so that that hospital can operate and serve the people of Jiwaka? Number two, I think in 2021, there was a groundbreaking, a launching of 5-level hospital, Jiwaka Provincial Hospital. And it's 3 or 4 years ago now. And are you going to build that 5-level hospital in Jiwaka province? Because since Jiwaka got its separate province, it's 13 years old now. And the national government is not doing anything for the people of Jiwaka. And that provincial health hospital was launched some years ago, but it's not happening. And I am asking the minister if you can build that level 5 hospital for the people of Jiwaka. And my third question is, there's a lot of rumors going around that your health system is failing the people of Papua New Guinea. Can you confirm or deny that your health system in Papua New Guinea is really failing the people of Papua New Guinea? Thank you, Mr. Speaker.
Honorable Minister for Health.
Thank you, True Long. To you, Deputy Speaker. Thank you, Long. Not Wagi. That's a very, very important question. We go along Nazarene Hospital 3 weeks ago. Me meet one them could line work lo have. The Chief Operating Officer, Dr. Ben, we look several work will make him. And then CEO of Churchill Services, Mr. Joseph Sika. I actually was there 3 weeks ago. It's one of the best health facility, I can say that, in the entire Highlands region, and compared to many of the facilities that we have as a government runs to him, although in people walk through. There was a Department of Health team that went last week, making full accreditation, determining whether the hospital by serving full level 5 or NOGAT. And I would say today to the people of Jiwaka that it actually achieved the perfect accreditation as now the level 5 provincial hospital serving people of Jiwaka and part of the country. So congratulations. A certificate will be given to them very, very soon. I come back to a question. First one, the 5 million kina now requested. I'm got the Luxave and it's on the everywhere on the social media. I can confirm that Jiwaka PHA funding belong online long Nazarene is about go through long I go through the budget of Jiwaka PHA on a yearly basis. That's something we look at along end. Now, you look at also Jiwaka PHA receives among the highest amount that goes to all the PHs every year. And this year, it's in people money. To date, 70%, 60% of the funding, you go to Jiwaka PHA or Kisimpinis. Olano Nasrin, Kuchip Hospital only request him 7 million kina, low operational funds, low, this year. Just 7 million kina. Out of the 7 million kina, they only received 1.7 million kina. So this last, now shortfall, buy more, something or this. So if we look, I'll be having a meeting with the team, management team we see in Port Moresby. I'll have a meeting with them today. I want to say today we have identified the funds and we'll make sure that the funding will be paid to them this week. That 5 million kina this week, because we have identified the funding. Actually, we will want to increase that funding. 5 million kina running 148 beds in Jiwaka. The hospital is actually having that's 55,000 annual attendance outpatient. 55,000 outpatient attendance this housing. People through 2,500 deliveries every year, and people through, and then 7,000 admissions every year. That's for a big level 5 hospital. I mean, meeting all the requirement, and to have a hospital where we run one time even now they're requesting for only 7 million kina, but we give I'll agree the system or recording like him only some 1.7 million kina to date. That's not good enough for them. We'll be having a meeting today. We've identified the funds, and we can give them actually more than 5 million kina. Will request him long end. That's the first point. We'll make him long end.
Thank you.
We'll make sure that that housing don't pass. I'm on the important hospital lo have. Now they're doing a good job. I need the church health service lo country bloyumi. One time Catholic health services they're running about 70%. Lo line bloyumi stuff lo rural communities bloyumi. Our government to make sure that they fully function. At the moment, only got 260. Or workman blow fully paid through the Alaska payroll system, never done before. So they're part of the 28 agencies under the Department of Health where we look at them long end. And to make this commitment to make sure we make the funding available as soon as possible. Second question, the member asked him long, Aussie Blow, Jiwaka Provincial Hospital. I'm fully aware of that. See that there's funding available this year. Excess budget by Mr. Workload Design. 2022, there was funding of 15 million kina given to all the PHs in the country. Because if you look somewhere sometime the COVID-19, you will get less than 50 ICU beds. COVID-19 exposed many of our failures, weakness in the health system. Less than 50 ICU beds. Today, I can say today that we have more than 120 ICU beds in the country today. No more, less than 50. We have more than 120 ICU beds now. We have actually progressed since COVID time is coming up now. So this is a system that we are seeing. I make the point, Mr. Speaker, yes, we will fully support the Jiwaka Provincial Hospital to complement what the Nasrin Hospital is doing. It will be on the budget, as it's on the budget, and we will make sure that we support them. Me appeal to Jiwaka PHA. They have 15 million kina allocated long all by need to make sure that only support him. It's arrangement too. There's a land available. Long bands. I saw that place myself, and I'm going to walk along and make sure that we'll deliver that place hospital for them. So number 3 question to the health system fail or not? And referring to Sir Puga's question yesterday, health system has not failed. Suppose you can deliver him successful operation kidney transplant this year, health system not failed. Health system not failed. We
Honorable Minister, we have a point of order. The Honorable Member for Aba, what's your point of order?
Point of order, the Minister really has to accept the fact that notices have gone out from public hospitals saying that there's no money, no medicines, they are sending patients away. That has never happened before. Therefore, today, the system has failed.
Honorable Member for Aba, it seems that you like to debate on the question, and I would not allow for that. So, Honorable Minister.
I want to say today, health system has not failed. 3 weeks ago, we started sending medical supplies to the 5 AMS. That was my response yesterday. Now, yet we look at Facebook also, no got margin next time. Today, we are now receiving reports from our medical supplies team to confirm. Milan Bay, we usually sent 620 boxes of medical supplies to Milan. Example. That's an example. It's going right across. So it is up to the provincial pharmacist, hospital pharmacists to do their order, place their orders. You go look at the district hospitals to place their orders. As we speak, there's system that's now there's a procurement going on as well to make sure that we beef up on our supplies too. So we are trying our best. 80% of the funding to PHs have been given. System will fail, Mr. Deputy Speaker. We are having control of our system. Can you just sit down and I continue to talk, please?
Yeah. Sit down. Honorable Minister, we have another point of order.
Needs to come out a little bit clearer. The system has failed. He needs to overhaul the system. Why the deliveries and why the deaths are happening, why the hospitals are closing, that simply shows that the system has failed and he needs to overhaul the system. Thank you.
Honorable Minister.
Take it through Myanmar's law, like it's a very, very vibrant topic and debate that we are doing. We go to Amonti Trakikia. There's a level 3 fully functioning housing where you got Dr. Now Stabloham. You go to Mohead today, there's a doctor there. So 3 hours flight from here to Mohead, there's a doctor there, the private healthcare facility. You go today to Lake Obiago, you got housing in the building Loham. You go to Koroba, you go to Kolosta, there's a hostel now, doctor by Stabloham too. So you go to Gaulim, there's a system, but the primary healthcare level, we've actually forgotten about this in the entire system for so many years. We are revolutionizing primary healthcare for the first time.
Good one.
For the first time, we are support with the DFAT and ADB. And as you see, you just go to Bogia. There's an infrastructure level 4. Next year, January, you guys come to Pomio district and see the first level 4 the greenfield in the country for the first time. I'm not saying this as a Minister for Health. It was there. So at the higher level, Mr. Speaker, next year we will deliver Kimbe, level 5 hospital. Next year we'll deliver Hela, level 5 hospital. All of these are now in the system to actually deliver them. Central Provincial Hospital. Okay, PMGH, this layer. Ongatamari look at the newspaper, Mr. Speaker. This layer, you may successfully deliver 2 kidney transplant in the Papua New Guinea system, health system. Is the system failing or not?
It's working.
At the moment, 2,000 line is supposed to go to Australia long heart problem blolia. Only go long cat lab system lo yumi long heart facility na. They're saving more than 200,000 one line supposed to go to have. System in a fail, Mr. Speaker. We will deliver the first state-of-art cancer facility by March next year at PMGH for the first time. And system fail or not? You talk about system, health, you talk about human resource. This year alone, government put in 3,000 workmen more into the health system. 233 million kina. When government gave them PE, over the 21 PHs, we delivered 3,000 for the first time. Yes? And then we have a standalone medical university for the first time. We are now declared unlong Vienna Convention also qualified to actually treat people with radiation in the country under the International Energy Atomic Agency for the first time in our country. All of these are happening. Sometimes must give credit where it's due. All the members of parliament, you need to sign a service level agreement with the PHS to support them where they actually test weaknesses. We have funding to support. We have 80% funding given this year, and we're going to support them. Yes, system, it's a system for health, HR, medical supplies, procurement. All of these are part of system. Human resource stuff inside. This is a system. System talk about something. We're addressing one by one, but many people walk through. But support from our partners who are now supporting us, I believe together we can achieve universal health coverage by 2030. I'm confident that we can deliver this. Thank you, Mr. Deputy Speaker.